Hi, this is Ify Okoronko. Today I want to talk about stem cells. Yes, I said stem cells. That's the latest buzz, not just in the bone world, orthopedics, but also in the beauty world. A lot of people are asking me, why are you using stem cells in your medical practice, and how does that work exactly? Well, I'm going to tell you exactly how that works. First, a lot of people associate stem cells with embryos, little babies. This is not that. These are adult stem cells, and in fact, these are your own cells. In your body, you have cells that are what we call undifferentiated. That means that they are not anything in particular. They're not skin cells, they're not liver cells, they're not muscle cells. They're just cells that are hanging out. A lot of them are in your abdominal fat, a lot of them are in your bone marrow, and they're just waiting to be called upon. So you're riding your bike, and you fall, right? You fall and you cut yourself. Well, that cut heals. And how it heals includes using my stem cells to bring in new muscle, let's say, if you tore a muscle, or bring in new skin cells, etc. And that's how healing works. One of the players in this whole process are your platelets. Those are the cells in your blood that call upon your stem cells. So when there's an injury, the platelets come in and say, oh my goodness, there's an injury. And then they call in all the different players that need to be called upon. Well, you can imagine when you have arthritis, let's say, or if you've torn your rotator cuff muscle, or maybe you have an Achilles tendon tear. All of these things require repair. Classically, we go to our orthopedic surgeon, and what do surgeons do? Surgery. That's right, surgery. So they will offer you surgery as a way to repair your injury. A lot of times people are not satisfied. Sometimes it works beautifully. Some areas are more difficult than others, like for example, an arthritic knee. Most of the surgery they do a clean out, right? But ultimately, the cartilage is degenerative. They call it bone-on-bone arthritis, right? You've heard that term before. And they recommend a total knee replacement. A lot of my patients, they come to me and they say, I don't want surgery, I'll do anything. And sometimes I may recommend to consider using their own adult stem cells and place it in that area of injury and see if perhaps your body can rejuvenate and regenerate the injured tissue. In the least, it will help to control the inflammation, to control your pain. So stem cells, we call them stem cells because they're the beginning, right? They haven't become anything. And then you can, in one branch, they can become muscle. They can become fat. They can become skin, right? But the origin is an undifferentiated cell that's just waiting to be called upon in your body. In beauty, we can actually utilize stem cells as well. We can utilize stem cells to volumize the face. What do I mean by that? Well, as we age, not only do we get wrinkles and sagging from the effects of gravity, but we also get changes in our face. We get the loss of the natural fat pad. You know how little babies' cheeks are so round and delicious? You just want to kiss them and squeeze them. Well, some of that is fat that just gives them that beautiful lift. And of course, some of it is the bony skeleton underneath. Well, as we age, not only does the fat tend to waste away and atrophy, and you can imagine loss of fat would go like this, right? And then suddenly you get a line here. But also the bone remodels, and it too flattens. Well, what if I said that while filler is an option, and many people utilize filler with excellent results, right? You can put some filler in your cheek and raise it up, right? And then, of course, you don't wait until it's totally flat, because then that would defeat the purpose. So right when you see it starting to lose volume again, you go back to your doctor and you say, I need more filler. And now your doctor, she's looking at your face and saying, yeah, okay, I think we're going to put it here, right? And so suddenly she's sort of playing God and making your face what she thinks it should be in terms of where she places the filler and the angle in which it's placed. And slowly, after one, maybe it's good, maybe the second treatment is good, but by the third treatment, you're starting to look like everyone else, right? Haven't you noticed that after you do filler for a few times, everyone kind of gets that same look, that look with the lips? Well, the beauty of utilizing stem cells and products that mimic stem cells, and we'll talk about that in a minute, is that we are using your own DNA. We're using your own DNA to grow your collagen, to grow your fat pad, to lift your face, to get rid of the wrinkles, to re-sculpt your face into that beautiful, youthful, lifted look, and it can only look like you. And it's not gonna look like everybody else. And this is what we focus on here at Beyond Beauty by Dr. O. And this is why regenerative therapies are at the core of my practice. Beauty from within. Beauty from within, utilizing your own body's tissue to rejuvenate, to regenerate, to form new collagen. So here at Beyond Beauty by Dr. O, my number one focus is to create and to tap into your natural beauty, to utilize your own tissue, to make it as healthy as I can, to grow your collagen, to grow your fat, to lift your face, to clear your skin, to remove those ice pick puckers, and do it all naturally. So the beauty that you see is your own and nobody else's. It's amazing. I was just on the telephone and somebody was describing to me about the deep, heavy bags that he has under his eyes. And he said that he would try anything to get rid of them. And he went on to describe how it's really starting to affect how he feels about himself, how he interacts with the world. And it's something that we can all relate to. Beauty, they think it's superficial, but really beauty is deep. It can affect you deeply. It affects how you feel about yourself, and this affects how you feel about your place in the world. So I utilize these therapies to bring out your true beauty inside and to lift you up so that you feel good, that you're happy when you look into the mirror, that you're happy when you walk into the world. I always like to remind everyone that as with any procedure, there are no guarantees. And in particular, regenerative medicine and the use of stem cells are not FDA-approved procedures. However, they are heavily FDA regulated, and I abide strictly by these FDA regulations. There's no mixing, there's no manipulation. I just take it out, I clean it up, and I put it back in you. And I love the opportunity to help you find your inner beauty, whether it's on your face to rejuvenate your face, whether it's your body to tighten your skin, or whether it's your vagina or your penis to grow your tissue, to lubricate your lining, to help you feel more deeply. All of these entities, really, they come together to enrich your life and to make you feel beautiful. So come in to see me, Dr. O, at Beyond Beauty by Dr. O. Help me to help you be your beautiful self.